Welcome back to the Deep Dive. We're your shortcut to getting genuinely informed, and hopefully we make it interesting along the way.
That's the plan.
Today, we're really plunging into something sensitive, complex, but absolutely vital: pediatric mental health.
Yeah, it's a world that has such a profound impact on kids, teens, and their families.
We're talking about challenges unique to this age group.
And understanding these challenges, well, it's crucial. Early intervention here isn't just helpful, it can literally change a child's entire life path.
So think of this as essential prep, especially if you're a nursing student.
Right, getting ready for the NCLEX, stepping into psychiatric mental health nursing roles. This is core knowledge.
Exactly. So our mission today, we're unpacking a key chapter from Varkarolis's Foundations of Psychiatric Mental Health Nursing, the 8th edition.
Specifically the one on childhood and neurodevelopmental disorders.
We're going to try to break down some, complex ideas, clarify diagnoses, look at evidence-based intervention.
You got to really translate it into actionable knowledge, things you can actually use.
So you're ready for exams, yes, but maybe more importantly, ready for the privilege of caring for these young patients and their families.
We'll cover the landscape, the risk factors, the nurse's role,
Assessment techniques, interventions.
and then zoom in on specific disorders like intellectual disability and autism spectrum disorder. We'll see how the nursing process guides everything.
Okay, let's start broad. The big picture.
Yeah.
Why is this area, psychiatric disorders in kids and teens, so significant?
Well, it really comes down to prevalence and impact. These aren't rare conditions, They affect millions.
And the impact goes way beyond just the child, right?
Absolutely. It affects their development, how they learn, family dynamics, everything. And it's complex, no single cause.
It's more like a web of factors.
Exactly. Biological, psychological, environmental, they all intertwine.
Okay, so when you say biological, is that mostly genetics? Or?
It includes genetic predispositions, yeah, but also neurobiology. Think brain development, brain chemistry, how those neural pathways are forming. Any disruptions there can increase vulnerability. It's usually not just one gene, but how genes interact with, say, stress or other environmental things.
Got it. And it's not just biology, right?
Yep.
Psychological factors must be huge, like temperament.
Precisely. Temperament, that sort of innate style of responding emotionally and behaviorally, you see it so early on.
And that influences how they deal with the world.
Definitely. A kid with a more reactive temperament might be more prone to anxiety, for example. But here's where it gets really interesting for nursing practice.
Okay.
Resilience.
Yeah.
That ability to bounce back, adapt, even thrive despite facing adversity.
Right. And resilience isn't just something you're born with. It can be nurtured.
Exactly. That's the key takeaway. It's not just innate strength. We can actively foster it.
What does that look like?
Well, things like strong family connections, supportive adults, maybe a teacher, a coach, or, a nurse, helping them develop problem-solving skills. Even small, consistent positive interactions in a clinical setting can build a child's self-belief and coping skills. It's like strengthening that resilience muscle.
Empowering them.
That's the goal.
And then there's the world around them, the environment. That's got to be massive.
Oh, huge. Family dynamics, socioeconomic factors, cultural background.
Culture seems particularly important here.
Absolutely. It shapes how mental health is even viewed, how it's expressed, whether families seek help, what kind of help.
And access to care, too, I imagine. Health policy stuff.
Right. All those layers matter for providing truly holistic, culturally sensitive care, which, by the way, is a big focus for the NCLEX.
Makes sense. Which brings us to the psychiatric mental health nurse, the PMHN. Working with kids seems like it demands a pretty unique skill set.
It really does. You need to connect with them on their level, understand that behavior is often their main form of communication.
Especially when they're distressed.
Exactly. And you have to involve the family, their partners in care. Always.
And the foundation for all this is the nursing process.
Always. Assessment, diagnosis, outcomes, planning, implementation, evaluation. That's our roadmap.
Okay, so let's talk assessment. It's not just ticking boxes, is it?
Definitely not. You're weaving together this rich picture from lots of sources.
Like who?
The child, of course, but also parents, caregivers, teachers, anyone who sees them regularly. Each perspective adds a crucial piece.
And a key tool is the mental status exam, the MSE. But you have to adapt it for kids. How does that work? Like assessing mood in a 5-year-old.
Yeah, you can't just ask a little kid, describe your mood or tell me about your thought processes.
Right.
So you adapt. You still look at appearance, behavior, mood, effect, but how you observe changes. For mood, you might Watch how they play. Are they engaged, withdrawn? What are their drawings like?
Observing interactions made.
Exactly. Interactions with toys, with you, with parents. For speech and thought processes, you use age-appropriate games, questions, maybe storytelling.
And insight and judgment.
Again, observed more indirectly. Maybe asking about rules in a game or consequences in a simple story. You're reading their world through their actions and play.
That idea of reading their world feels really central because you need that developmental lens, right?
Oh, absolutely critical. You're constantly asking, is this behavior typical for this age?
So you can tell the difference between, say, normal toddler stuff and a real delay or disorder.
Precisely. A 4-year-old using only single words, that's a potential flag. A 2-year-old doing the same might be perfectly fine. It's all about that developmental context.
Okay, so once you've gathered all that assessment data, what kind of general interventions do nurses use?
Behavioral interventions are definitely a cornerstone. Things like setting clear limits, having consistent routines, using positive reinforcement.
Creating structure and predictability.
Exactly. A supportive environment where they can learn and practice new skills.
And it goes beyond just behavior charts, right? There are specific therapies.
Oh yeah, lots of tools in the toolkit. Play therapy is a big one, especially for younger kids.
Because play is how they communicate.
It's their natural language. It lets them express feelings, work through conflicts, process things they can't maybe put into words. And interestingly, some research suggests play therapy can actually prime the brain, make it more receptive to other therapies like CBT later on.
Wow, so it's more than just playing.
Much more. Then there's bibliotherapy.
Using books.
Yeah, age-appropriate stories where kids can identify with characters facing similar issues. It helps them feel less alone, maybe see some coping strategies.
What else?
Expressive arts therapy, drawing, painting, music, drama. Another way to communicate and process emotions non-verbally. For older kids and teens, journaling can be great, a private space to sort through thoughts. And music therapy uses music in targeted ways to help with emotional, cognitive, or social goals.
It sounds like a lot of these involve creativity and expression.
They do, but none of it works well in a vacuum. Family interventions are almost always needed.
Because the child is part of a system.
Exactly. You need to engage the family, provide education, maybe work on communication within the family. It's vital for lasting change.
What about medications? Psychopharmacology.
It's used, definitely, but the approach is generally cautious in pediatrics. It's almost always part of a bigger plan medication, plus therapy, plus family support, plus school accommodations, a multimodal approach.
And safety has to be woven through all of this.
Non-negotiable. And that means teamwork, too. Nurses, doctors, therapists, social workers, teachers, everyone collaborating.
What about managing really difficult situations? Disruptive behavior.
That's a core nursing skill. Recognizing triggers, using de-escalation techniques first, always trying the least restrictive approach. But you also need clear safety protocols.
Like if there's a risk of harm.
Right. Crisis intervention skills are essential. That might involve suicide precautions, ensuring a safe environment, managing aggression safely, all while addressing the underlying distress. These are definitely key areas for NCLEX prep.
Okay, let's shift gears slightly to advanced practice interventions. Things like group therapy. What's the benefit there for kids or teens?
Group therapy can be incredibly powerful. Peer support is huge, realizing I'm not the only one feeling this way. Plus, it's a great place to practice social skills in a safe environment.
And cognitive behavioral therapy, CBT, how does that work with younger people?
CBT principles are adapted. It's about helping kids identify those unhelpful thought patterns.
Like negative self-talk.
Exactly, or catastrophic thinking. And then challenging those thoughts and learning healthier ways to cope with feelings and situations. Teaching them practical skills, like retraining those automatic responses.
Okay, now let's really zoom in on a couple of specific neurodevelopmental disorders, applying that nursing process.
Sounds good. We should mention there are several categories: communication disorders, motor disorders like tics or coordination issues, specific learning disorders. Nurses see all of these.
Let's start with intellectual disability, or ID. What are the core features?
Okay, so ID involves deficits in two main areas. First, intellectual functioning, reasoning, problem solving, abstract thinking. Second, adaptive functioning.
Adaptive functioning, what does that cover?
That's about the skills needed for daily life. Conceptual skills like language and literacy, social skills like following rules and interacting appropriately, and practical skills like self-care, chores, managing money later on.
So, applying the nursing process. What's key in assessment for ID beyond just an IQ number?
You're really looking closely at those adaptive skills. How independent are they with dressing, hygiene? How do they interact socially? Can they follow multi-step directions? Manage simple tasks? You gather this from observation, talking to parents, maybe teachers.
And then a nursing diagnosis might be.
Could be something like impaired social interaction or self-care deficit linked to the specific challenges. And your outcomes need to be really concrete, measurable.
Right.
Patient will participate in a group activity with one prompt, or patient will independently brush teeth using a visual schedule, something very specific you can track.
Makes sense. And implementation. What are nurses actually doing?
A lot of psychosocial interventions. Teaching adaptive skills step by step, often breaking tasks down, using visual aids, schedules, routines.
Promoting independence.
Yes, encouraging them to do as much as they can for themselves, and crucially, supporting the family. Providing resources, education, emotional support. It's a partnership.
Can you give a quick example? Like teaching a skill.
Sure. Say teaching hand washing, you might use a picture chart, turn on water, wet hands, get soap, rub hands, each step shown visually. You'd model it, provide prompts, use positive reinforcement.
And evaluation is just checking if they met the outcome.
Checking progress towards the outcome, yeah. Are the interventions working? Do we need to adjust the plan? It's that continuous cycle.
Okay, let's move to autism spectrum disorder, ASD. You mentioned it's a spectrum.
Absolutely. Keyword is spectrum. It presents so differently in different people, but the core features involve challenges in social communication and interaction.
Like understanding social cues, back and forth conversation, nonverbal communication.
Exactly. And the other core feature is restricted, repetitive patterns of behavior, interests, or activities.
That could be repetitive movements like hand flapping or maybe intense focus on one specific topic.
Yes, or needing routines to be exactly the same. Sensory sensitivities, lots of possibilities. The spectrum ranges from individuals needing very significant support to those who might primarily struggle with social nuances.
So for the nursing assessment with ASD, what are you looking for?
You're observing social interactions very carefully. Eye contact, response to name, how they initiate interactions, play skills. You're also looking for those repetitive behaviors or intense interests, sensory responses.
And diagnoses.
Might be impaired verbal communication, risk for self-mutilation, perhaps related to sensory overload or frustration, social isolation. Again, tailored to the individual, outcomes need to be specific too.
Like patient will respond to greetings from staff 50% of the time.
Something like that, yeah. Or maybe patient will use a visual schedule to transition between activities without agitation. Measurable progress.
And interventions for ASD. What's the approach?
It's often a mix. Psychosocial interventions are huge. Behavioral therapies like ABA, applied behavior analysis, are common. Structure and routine are often essential for reducing anxiety.
Communication strategies too.
Definitely. Tailored to their level. Maybe using visual supports like text, picture, exchange communication system, sign language, or just very clear, direct language. Psychopharmacology might be used, but typically for co-occurring issues like severe anxiety, aggression, or hyperactivity, not the core ASD symptoms themselves.
And evaluation is checking if those strategies are helping.
Right. Are they communicating more effectively? Are challenging behaviors decreasing? Are they coping better with transitions? Adjusting the plan based on what works for that child.
Can you paint a quick picture, like that therapeutic communication piece?
Okay, imagine a child with ASD, let's call him Leo, gets overwhelmed by noise in the day room and starts hitting his head. Instead of just saying, stop that, a nurse might get down on his level, speak calmly. Leo, it's too loud in here. Let's go to the quiet corner.
Validating the feeling, offering a solution.
Exactly. Maybe offering headphones next time. It's about understanding the reason behind the behavior and responding supportively, advocating for their needs. That's patient advocacy in action.
That makes sense. And we should quickly mention ADHD, attention deficit hyperactivity disorder.
Right. We didn't break it down fully, but it's another major neurodevelopmental disorder. Nurses absolutely apply the same nursing process assessment focusing on inattention, hyperactivity, impulsivity.
Diagnoses like impaired impulse control, setting outcomes like patient will complete a 5-minute task with minimal redirection.
And implementing strategies like behavioral plans, environmental adjustments, helping with organization, and often collaborating on medication management. Definitely need to know ADHD for the NCLEX too.
Throughout all these examples, what keeps coming up is the ethical dimension. Advocacy, cultural competence.
Absolutely essential. You have to make ethical decisions, always advocate for the child's best interests, and understand care within their cultural context. You're not just treating a disorder.
You're treating a whole person, a whole child, within their family.
Precisely. It's holistic, patient-centered care. looking beyond the label to see the individual's strengths, challenges, hopes, supporting their journey.
Okay, so wrapping up this deep dive, we've covered a lot. The complexity of these disorders, the vital role of the PMH nurse,
The importance of thorough assessment, evidence-based interventions.
and how the nursing process structures everything, always focusing on safety, ethics, and the individual child.
We really hope this has given you a solid foundation, a useful shortcut to understanding this crucial field. It's more than just facts, it's about building that compassionate lens.
So here's something to think about. How could really effective early intervention for neurodevelopmental disorders ripple outwards? Not just changing one child's life, but maybe impacting society more broadly.
Yeah, creating a more inclusive, understanding world. And on a personal level, how can you, as a future nurse, help reduce the stigma around pediatric mental health?
Making it easier for kids and families to seek help without feeling judged. Well, thank you for joining us on the Deep Dive. From all of us here at the Last Minute Lecture team, remember you're not just learning information. You're building the empathy, the insight, the skills to be amazing mental health professionals.
You really are. You've got this.